Hello, we're Group 10, Nanjiba Murshid and one Yohang, and we'll be talking about a drug that is given to treat hypertension.
I'm Nanjiba Morshed, and I have my group member.
I'm Yiheng.
And today we will be interviewing Yuhong's dad on the case study that we are given. So first we will be proceeding with some questions by asking Uncle. So the first question that I have is, what's the drug that you have been taking and why?
The drug that I've been taking is Entrestol 200 milligrams, and I'm taking half a capsule each time and twice a day. Basically, I'm taking the medication owing to the hypertension.
Okay, so what are the symptoms that you had for what you started taking this medicine?
I've gone through a serious headache and nausea. Sometimes I do feel like vomiting after strenuous activity.
Okay, and how do you feel before taking this medicine and now after taking this medicine? How do you feel? The changes basically.
Before taking this medication, I feel a headache every day, and it has severely disrupted my daily routine. However, I feel like after taking it, my head feels less heavy and more relaxed while carry out my daily routine or even strenuous of exercise.
Okay, and did you face any side effect while taking this medicine, or even right now, is there any side effect?
I never faced any side effects when I first started taking this medication, and moreover, I also never experienced any side effect after a long period of medication.
Okay, and how long, since you have mentioned you were taking it for a long time, so how long have you been taking this medicine for?
I have been taking this medication for more than 3 years.
Okay, that's a long time. So I think this is enough for our information, and we will be proceeding with this information that you have given to us. Thank you so much for giving us your time. And yeah, thank you so much.
Thank you so much. Thank you.
Thanks to the interview carried out by Nanjiba, without further ado, we'll be starting from the introduction of Entrestol. First of all, Entrestol contains a salt complex of two major chemicals, sacubitril and valsartan, which are only dissociated in two after oral administration. Besides, it must not be stored above 30 degrees and it belongs to the class of angiotensin II receptor blockers. Moving on, Entrestol is prescribed to adult patients for treatment of hypertension or symptomatic chronic heart failure with reduced ejection fraction. Besides, it's administered in combination with other heart failure therapies medications such as ACE inhibitor or ARB. It's recommended that the starting dose of Entrestol be 1 tablet of 100 mg twice daily, but dosage should be added up to 200 mg at 2 to 4 weeks as tolerated by the patient. Next, we'll be talking about overdosage and contraindication. It's known that a single dose of Entrestol 1200 mg will be the limit dosage for humans, and it can cause severe hypertension if overdosed. Besides, it can't be removed by hemodialysis due to high protein binding. On the other hand, there are people who are hypertensive to this active drug, people who are taking ACE inhibitors, or people with severe hepatic impairment, biliary cirrhosis, cholestasis, and pregnancy. Every drug comes with the side effects, and there's no exception for Entrestol. The most commonly reported adverse reactions during treatment with Entrestol were hypertension, hypokalemia, cough, dizziness, and renal failure. Carry on, Entrestol exhibits the mechanism of action of angiotensin receptor neprilysin inhibitor by inhibiting neprilysin and blocking the receptor with valsartan. The complementary cardiovascular benefits of Entrestol are attributed to enhancement of peptides and result in increased concentration of the cGMP, which cause vasodilation, diuresis, increased renal blood flow, and etc. The pharmacodynamic effects of Entrestol were evaluated after dose administrations in control patients with heart failure and are consistent with simultaneous neprilysin inhibitions and RAS blockade. In a 21-day study in reduced ejection fraction patients, Entrestol significantly increased urine and plasma cGMP and decreased aldosterone compared to baseline. The AT1 receptor was also blocked by the increased plasma renin activity and concentrations. Pharmacokinetics consists of four different phases: absorption, distribution, metabolism, and excretion. First of all, Entresto is dissociated and takes up absolute bioavailability of 60% and 23%. Subsequently, drug distribution shows that sacubitril, which is converted to active metabolite, and valsartan, which is minimally metabolized, are highly bound to plasma proteins to up to 97%. Last but not least, around 60% of sacubitril and 30% of valsartan are excreted in urine. Around 40% of sacubitril and 86% of valsartan are excreted in feces.
Now let's see why Entresto is given. Entresto is given to the patients who have hypertension. It is also given to treat asymptomatic heart failure with systemic left ventricular systolic dysfunction in pediatric patients aged a year old and older. Besides, it helps to carry on with regular activities in life. Now, Entresto is a very effective drug, but it has some alternative drugs as well. In case there is no Entresto in the market, this can be taken. So the alternative drugs for Entresto are losartan or carvedilol or irbesartan. Now, losartan is used to treat hypertension in both adults and children, and it also helps your kidney to work better and reduces the risk of stroke in case the patient has high blood pressure and a condition called left ventricular hypertrophy. Carvedilol is an oral capsule, and it works the same as losartan, but it also helps to treat problems after a heart attack, and it is a beta blocker. Now, moving on to irbesartan, like the two other drug, it is also an oral tablet, and it is an angiotensin 2 receptor blocker, and sometimes called an ARB. It is used to treat heart attack, heart failure, lower the blood pressure, and kidney problems too caused by type 2 diabetes. In this slide, you can see the statistics of patients taking all the alternative drugs, including Entresto, all over the world, except for irbesartan. This drug only includes the statistics of US. Now let's look at some interesting facts about Entresto. Taking Entresto can affect the BNP level. This combination also offers a synergic effect on preserving heart and kidney function. Basically, it's a hormone that the heart makes to help the doctor check blood levels of BNP and a related hormone called anti-proBNP to monitor heart failure. BNP and anti-proBNP levels typically go up when the heart failure worsens and go down when heart failure is stable. BNP and anti-proBNP don't cause heart failure though, but it's just a chemical marker that doctors use to check the heart health and your heart's response to Entresto. See how Entresto affect DMD. So DMD is a genetic X-linked neuromuscular disease caused by mutation of the dystrophin gene, leading to early progressive muscle failure and enlarged cardiomyopathy. Entresto was used to check the reaction on this disease. The aim of this investigation is to evaluate whether the treatment with this drug has higher tolerance and may have beneficial effects in DMD patients with left ventricle dysfunction. So from the study, a significant improvement of LV ejection fraction was observed, and no relevant side effects were reported throughout the period of the study. CRS is the leading cause of most death case in hospitalized patients. SAC or bell therapy has been proved to improve prognostic outcome in patients with heart failure or chronic kidney disease. This study tested the theory of the combined levosimendan and SAC or bell, which is superior to just one therapy on protecting the heart and kidney against simultaneous heart and kidney issues. Combined levosimendan and SAC or bell was superior to merely one therapy on protecting the heart and kidney as well as preserving their functions against double IR injury. The combined mechanism of levosimendan and SAC or bell therapy protects the heart and kidney against cardiorenal syndrome. Now, hearing the case study from the interview and looking at the drug, it can be said that Entresto is a very effective drug and for hypertension because the dosage amount is standard and the number of people taking it is pretty high too. Besides, it doesn't treat only heart, it helps with kidney too, but like everything else, it has some of its side effects too. If the right direction can be followed, then the best result out of it can be found. So that was all from our group. We hope you have enjoyed your time and it was an insightful presentation. Thank you so much.